Morning. Good, how are you? Mary and Rochelle are sitting right here too. Thank you.
My reputation precedes you. Yeah, exactly.
It is 10:45, and you guys get the award for being most organized. Good job. That's right. Give yourselves a hand. Come on in, friends. I know we want to get started, and I know you don't want to miss this, so come on in, come on in, come on in. And if you need to, step out and refill your coffee, no one will look at you weird, right? Can we have a covenant agreement about that? Okay, good. I am thrilled to introduce to you some of the folks that are here through the Outpost. So I have gotten to spend a lot more time with them than any of you have, I think. And so I'm really grateful. But I don't have last names for everyone. I should have asked for those 100 times, except for you, because now I've learned how to say it, maybe. Okay, this is Elena. What's your last name, Elena? Chris. And Elena is a undergrad intern at St. Ben's, and she is going to kick off our presentation, and it will be up on the screen, but she has a lot of work that she has done this summer to help the clinic get organized, and I'm sure she'll tell you more about that. Is that good enough?
Yes,
okay.
Thank you.
Then, yes, welcome. Thank you for doing this. All right, let's start there, and then we'll introduce everyone else as we go.
Okay, perfect. Good morning, everybody. Thanks for letting me come. My name is Elena Kriz. I'm a rising junior nursing major at St. Ben's. I'm from Minnesota, closer to the city. So this summer, I got a chance to live on campus and participate in this community, become a part of St. Cloud, really get to know this area, and help develop the clinic, which is super awesome. So that's why they picked me to come and talk, because I've spent my whole summer here. I've gotten a chance to meet a couple of you at either the ribbon cutting or popping in here for meetings, which has been nice. So I put together this short orientation presentation just to give everyone kind of an idea of what's going on and where the people who are developing the clinic side of things are at, just so we're all on the same page and can do this together, which is exciting. So first, just a couple things we're going to talk about. The basic mission and vision of the clinic, what our goal is, why we chose to partner, and how this is going to be beneficial for everyone.
They're not going to be able to see that. So
okay, perfect. Yes. Just a short introduction to the clinic, the type of people who are going to be working at the clinic, what healthcare professionals and other systems are going to be there in place, our connection to Project HEAL, and then Officer Tad is also going to be giving a talk on his team and all the cool things they get to do here too. So our mission and vision will be posted pretty much everywhere, but to kind of condense it and to really explain to you guys why we wanted to be here is because when we were looking at data and statistics, we obviously saw a need in this area of St. Cloud, maybe you guys living here also feel that maybe there was a healthcare gap, or you see people in your community that you feel like could benefit from extra resources. Maybe you know people or have seen them. And so we really wanted to come together and work with, the Public Safety Foundation and Centric Care and St. Ben's and St. John's nursing students to create a place where resources and healthcare were accessible and exciting. It's exciting to have a new clinic and give that new life to your community in this area. And the fact that you guys are so a part of it, literally sharing a building and get to be a part of it in this way is so special. Nowhere else is doing this. And so Salem is really groundbreaking in that way, and so thank you for letting us be here and doing this together. About us, so the St. Cloud Safety Foundation is a part of it. We have community paramedics, social workers, St. Ben's and St. John's faculty, the St. Cloud Police Department, volunteers. That includes external volunteers from the community of St. Cloud, but also if anyone here wanted to volunteer, you want to come hang out with people in the waiting room, say there's kids or toys and things like that, or you want to come help for a foot care day, or you were previously a healthcare provider or are a healthcare provider and want to volunteer some of your skills, those would also be something that you now have an opportunity to do right in your own home, which is really awesome. So members of the Salem Church community, you guys, we're really excited to have you and to have you be so welcoming. I spent a lot of time here this summer, and I absolutely loved it. Everything about getting to come here and hang out and meeting everybody, and I never felt like there was anything other than love in this building, and I think that's so amazing that now we get to share that with so many more people in St. Cloud. I noticed that this church is such a staple in this community. People use it as a landmark, oh, it's past Salem, or things like that, like you really are and have been a part of this community for such a long time. And so it is really cool that now you guys are on this journey with us to kind of step up in a new way for the community and show up in not typical way. Most churches don't have a clinic, so this is a new and exciting way to do this. Intro, we'll do basic point of care testing. So what that kind of is like, you need a quick strep test, or you need a quick pregnancy test, or things like that can be performed inside a clinic. So it wouldn't be like anything we would have to send out somewhere else. So it wouldn't be like a blood test that would have to go get tested somewhere else. But primarily it's going to be education-based information at this clinic. So this summer I worked to help develop more of the undergraduate nursing role. And so that's focusing more on preventative health, how to eat healthy, where to go to eat healthy, how do you learn to take care of yourself, you have a kid, you're a new parent, how do you take care of your kid, what vaccines does my child need, things like that not everybody is taught, not everybody was raised speaking in healthcare terms, so this will also be an area where you can go if you don't understand your discharge papers and you want some extra explanation, or you get diagnosed with a chronic health issue and you don't know where to go next. You can come to the clinic, talk to an undergraduate student, and they'll help connect you to further resources out in the community. So it really is like a branching off place to get people further connected to larger healthcare. So there's going to be a couple different roles at the clinic. The undergraduate nursing student professors are here in the front row, so they'll be bringing 4 students here to be the undergraduate, which means like a registered nurse. So that's the typical nurse you see at a doctor's office. They kind of check you in, they talk to you, they might do your intake form, things like that. So that's going to be more of what I focused on this summer, but we also get to have graduate nursing students as well. So the undergraduate nursing students will be there Mondays and Wednesdays afternoon. They're going to do more health promotion. That's going to be the education type stuff I talked about before. They're going to refer and connect patients to anything that they're missing. There's no use in getting a prescription if you can't fill it. There's no use in getting a prescription if you're not going to take it or you don't understand what it means. And so really starting all the way over. What's the main complaint, but also what's stopping you from getting better? Because like this much of healthcare happens in an office, and then this much of healthcare happens in the rest of the world on your own, you know? And we're really missing that here's why you do it, and here's how you actually do it. So the undergraduate students are primarily going to be focusing on educating. The nurse practitioner students, they are going to be the ones who are more able to diagnose and prescribe because that's in their scope of practice. So that would be somebody comes in, needs an antibiotic. That would be something specific to the nurse practitioner students because that's what they are now learning to do. So they're a step above the undergraduate students. They can do like sports physicals, things like that. Yeah, so they will also be coming here starting this fall, which is exciting. And then the student experience at Salem, for both the DNP, FNP, and RN students, it really is great for us to get to come here because we get to be immersed in a community. We get to spend our time off campus in the real world, getting to learn those hands-on clinical skills, practice educating. So it is beneficial for St. Ben's and St. John's students to be here, and we also learn a lot. We then learn how patient interactions work and all of that stuff, and so that's really awesome that this is now a space that we get to learn in too, which I think is cool. The volunteer role, like I said earlier, can look really different depending on what your skill set is. I think that that's really cool because if you aren't able to really move around, get down, like to wash somebody's feet and help out, you can sign someone in at the front desk, chat with somebody about how their morning is going before they're able to be seen by a student. Or if you want to be involved and help organize something, or we have a health promotion thing we're setting up and it's about a chronic disease that maybe you even have yourself and are looking for some more education on, you can come and you can be a part of these things either in a volunteer role or an educational coming here for resources yourself as well. For volunteers, it's nice because it is a super flexible schedule. We're not here all the time. And so that will be cool to be able to choose how involved with the clinic you want to be. Obviously, we share a space, but if healthcare isn't your thing, you also don't have to go over to the clinic side. Project HEAL, just wanted to, I always get questions about funding. How does this happen? How do you have a free clinic? What does that mean? Where does that come from? So we're fortunate enough to have a couple different community partners that are helping us be able to be a part of this. One of those ways is CentraCare's Project HEAL. It's been around for about 25 years, which is a very long time for especially a public health initiative to be around and growing. So CentraCare took us under their umbrella, and basically that allows us to have the kind of testing we have in the space, and then also those extra healthcare providers that then will help back us at St. Ben's and St. John's. So when we're not able to be here, there will still be services, so we're not leaving people hanging. And so that is for stability and kind of that, to keep it going and moving. There's always somebody who's going to be here and be involved. Important things to remember, St. Ben's and St. John's, for those of you who don't know, it's Benedictine Catholic, and so one of the Benedictine values is to listen with the ear of your heart. There's a lot of different circumstances that might bring somebody to have to need to come to the clinic, and it might not be what you think it's for. It's really easy to see somebody using free clinic services and be like, okay, yeah, they need those, but also anyone can use free clinic services, and that's what's so awesome is it really is just knowledge that everyone could have. You might pick something up from the clinic, like a flyer for a friend of yours, for a disease that they recently got diagnosed with that maybe they don't have all the answers either. So although it is in this area for a reason. We did pick this and really are working to improve statistically what's going on in St. Cloud. We also just really care about people, and we want people to be further connected with each other. So, and then Officer Tad and his team are so cool. They even have a dog named Ripper. Do you want to come up and chat?
Cool. All right, Sergeant Tad
Oh, thanks.
Hessian. Sergeant Tad Hessian is the lead team for the team that will be officing here, and we will have him tell us more about what that might look like.
Good morning. I have to have the mic because ADHD is real in this vessel, and I can't stand still very long at all. I also, as I was sitting down, just realized something. I think the last time that I was in front of a whole bunch of people from this congregation was about 40 years ago, and I was much more adorable than I am now, wearing a robe, and a member of the St. John's Boys Choir. So that's how long. It's a little bit about me, too, to tell you that I'm a kid from Pantown. I grew up in St. Cloud. I love St. Cloud. I didn't always. As an angsty 18-year-old and a fresh graduate from Apollo High School, go Eagles, I decided I would never, ever come back to St. Cloud again, but I lied to myself because I realized St. Cloud was a great place to raise a family, which my wife and I did, raised 3 amazing boys who are now adults and somebody else's problem, which is awesome. But about me and my career, we've had the chance to do a lot of things here at the St. Cloud Police Department. One of the reasons why, as I started my law enforcement career out in Kansas, decided I wanted to come back home was because I think in St. Cloud we do it right. Let me scrap that. I know in St. Cloud we do it right, because we work with the community. Our mission and vision, I don't know how many of you, when you are working or working currently, know the vision and mission statement of your agency that you worked with or the company you worked with. I'm a dork, and I do. I love it, because our vision and mission with the St. Cloud Police Department is we will work with the city and with the community to be a participatory police department to make St. Cloud a better place to live, visit, and work. And we believe that, and we believe in it. And every time we get extra people, we don't just throw them on the road in blue suits and police cars. We figure out what it is that the community needs. And in the 1990s, we created a team called the Community Crime Impact Team. And the Community Crime Impact Team was designed to address unique problem-solving issues, things that were affecting the community, whether it be we had a rash of burglaries, or we were upset because Division Street wasn't run very well and people were rear-ending each other, which that's still happening, so we didn't fix that. But we addressed those types of community-based problems. But what tended to happen was the people who were in that team, and usually, generally speaking, it was 2 to 3 officers and 1 sergeant, and they would address the things that the community needed, but they would also kind of go towards the passions that they had as well and create some really cool things. And over time, it kind of evolved into from a uniform drug unit to a traffic unit to it focused on issues with St. Cloud State University and the tech college and the neighborhood stuff and rental properties and you name it. In 2018, by that point, I had been a patrol sergeant. I'd been promoted in 2015 to rank a sergeant. I was working the road, and I got asked if I would come back and run a relatively new division called our Community Engagement Division. All of the stuff that we were doing to engage the community, we wanted to throw into one division. And right now, that's 28 of our 122 officers are within our Community Engagement Division, meeting the people where they're at to try and work with them to make St. Cloud a better place to live, visit, and work. And what I was told when I came back in 2018, and I had been a member of the Community Crime Impact Team from 2012 until I got promoted in 2015, but what they said was, when you come back and you want to run this team, it's not going to be what it was. We had a group that got together from Centricare, from all 3 counties that we're in. By the way, St. Cloud being in 3 counties is a unique challenge. And it's kind of a pain from time to time. But it's a unique challenge. We get to all 3 counties, Central Minnesota Mental Health Center, NAMI, a whole bunch of groups got together and said, we think we have a problem in St. Cloud and in Central Minnesota when it comes to folks experiencing mental health crisis or dealing with a mental health problem, and we're doing the same thing over and over again and expecting a different result. And somebody once told me that's the definition of insanity. And we keep doing the same thing and the same thing. And so they said, hey, do you want to come back and run this team and focus on mental health? Now, Rewind to when I started my career as a young cop in Kansas and a young cop here in 1998 when I first started and put that beautiful blue uniform on. If you'd have told me I'd be ending my career essentially being a social worker with a gun, I would have thought very violent things about you, because I didn't think that was going to be my mission. I didn't think that was going to be my vision. But very often, as people in this group can probably attest to, we can't always say what our plan is going to be, right? And so I think the plan really came into maybe effect. Maybe I'm good at it, maybe I'm not, but I lead an awesome team that based on what we were seeing, we needed to address when people were having a mental health crisis, when people were experiencing homelessness, when people were experiencing things that they just couldn't explain. And that's what we threw it into a whole bunch of people into this problem. It started off in 2018 with me and one officer essentially working with all of our counties, working with Central Care, working with NAMI, working with Central Minnesota Mental Health Center to see how we could stop the cyclical behavior. But get this is amazing. From 2010 to 2017, the St. Cloud Police Department was identifying 1,100 people a year that we believe based on statute were a danger to themselves or others, and we by force took their freedom away from them and brought them to the St. Cloud Hospital for a psychological evaluation. We use words like 253B because that's the statute that allows us to do that, but we did that 1,100 times a year just in the city of St. Cloud. And the St. Cloud Hospital kept longer than 2 hours 8% of those people. And if they don't have proper insurance, the folks that we force to go to the hospital, it's $3,800 just to walk in. Somebody else is paying that bill. We were doing the same thing and expecting a different result. So using police data, using what we have, because 95% of what we have in law enforcement, believe it or not, is totally and completely public information. So we tapped into that. And every day, my team sends 47 different emails for an email to 47 different email recipients, and giving them all the information of everybody whose freedom we took away from them. Whether it's a transport hold to the hospital, to detox, to the VA, or unfortunately incarcerating somebody for a crime that they committed or accused of being committed, that's what we do and send it out to try and stop the cyclical behavior from happening, to try and stop the unwantedness of people who are just having a really bad day and address it where it's at. So over the course of that 2018 to 2020 or so, we realized we could use some help. So we created the first of its kind in central Minnesota and the second of its kind in the entire state of Minnesota, and we created a co-responder team, meaning I didn't just want cops respond to these problems, I wanted social workers respond to them as well. Because I think that's what people need. Not necessarily a blue suit cop. I think we do pretty good at addressing the mental health needs, but why not have an expert come right with me, right at that moment? And so that's what we did. We hired a therapist from Central Minnesota Mental Health Center that we embedded with our officers, and very quickly we realized, holy mackerel, that works. That was amazing. We're meeting people right where they are in the crisis. And I don't like to rest on my laurels, and I saw it was working, so I added another one. And then I added 3 paramedics, and then I added a puppy, because why not, right? And started adding a bunch of stuff because it works. And what we found is that team now made up of 2 police officers, a dog, 2 social workers from Central Minnesota Mental Health Center who have advanced graduate degrees and licensures, and now 2 community paramedics for Mayo Ambulance. That community collaboration responds 7 a.m. to 9 p.m. Monday through Friday to all acute mental health emergencies in the city of St. Cloud, meeting people where they're at with some iteration of that to try and figure out what it is they need in that moment and stop the problem from happening and not make them feel like they did something wrong when they're just having a bad day, or they're just having a bad cycle, or they're just having a bad go of it. Who knows? And what we found was in 2024, my team, just 6 of them, responded to, in the city of St. Cloud, 880 mental health calls for service, resulting in, from 1,100 a year that we were bringing from 2010 to 2017, we got that number down in 2024 to 639. I went to Apollo, I can't do the math, but that's a lot, right? That's a huge reduction. Go Eagles. And if there's probably a couple of my teachers in here, and I apologize for that, but you were lovely, I promise. But if we do the math and say 50 to 60% of those folks don't have proper insurance coverage, that's a savings to the taxpayers of $1.2 million. This year, we are on pace, my team, to respond to 1,000 mental health calls for service, the team that will be based out of the second floor up here, that they are going to respond to 1,000 mental health calls for service. somebody who's having a behavioral health crisis, somebody who is in the middle of the road kind of acting wonky, somebody who expresses that they don't want to live anymore. That's the calls that they get to go to and try and figure out is how they can help that person in that moment and stop the cycle from happening. And we were on pace to reduce forced hospitalization down to less than 400. That's huge. It's massive. Mental health isn't getting better, by the way. That is 400 unique cases. That is 400 unique individuals experiencing a mental health crisis. And that's how we stop it from happening, is make sure that person gets the resources and the things they need at that moment. But what we realized was, as we jump into the next iteration, because my brain, if you can't tell, never stops thinking about how we can maybe help or how we can do cool stuff or whatever it is we can do to help in that moment. And what we thought was, why don't we have a place where we can meet the public where they're at? And what we know is this: the neighborhood that we're sitting in and standing in right now needs help. Unlike the other two community outposts or cop houses that we have within the community that are kind of immersed or within where there's a lot of families and things like that, what we see in this neighborhood is the vast majority of the folks. One thing I just heard from a county commissioner that blew me out of the water was, of all the people that live in this little swatch of St. Cloud that's in Benton County, 80% of them live below the poverty line. I knew it was bad. I didn't know it was that bad. And what we tend to find is poverty doesn't necessarily mean that they're a bad person. It means they don't have access to resources. It means they don't know what to do when they're in that crisis. It means they don't know how to get the help that they need in that moment. So why wouldn't we be here to help? Why wouldn't we, what the taxpayers allowed us to do, why wouldn't we put our money where our mouth is and just help them right here and there? And that's why we want to be here. And that's why we want to be in this building, because we believe it's a conduit for us to be able to do awesome, amazing things and meet folks where they're at. And the first question that I'm going to get is, are you going to bring a bunch of people who are having an acute mental health crisis, who are experiencing homelessness? Are you going to bring them to our church? No, that's not what we're going to do. We're going to be here to respond quicker to the problem. And once we believe a person is stable, are we going to have maybe some times where we can do group therapy? Yeah, absolutely. Are we going to host NA and AA classes? Yeah, I want to do that too. Are we going to have goat yoga? Yeah, why not, right? I'll clean up after the goats, I promise. But are we going to do something to meet people with what they need in the moment once they're in that stabilization? Absolutely. Are we going to arrange some of our community partners and use some of the things and the relationships that we've had since 2018 or beyond? And are we going to try and meet folks where they're at to get the resources they need? Like, I don't know, healthcare navigation, because a lot of people don't have proper healthcare? You're darn right we are. Are we going to get somebody, a social worker, that maybe can do a case management through either the county or Central Minnesota Mental Health Center or Centricare? You're darn right we are. We're going to meet people right there to try and stop that cycle from happening. And if you're like, why in the heck is a guy with a gun on his hip talking about this stuff? Because this stops people from going to jail. This stops people from going to prison. The three largest holding facilities of mental health holding facilities in the country are jails. One in Los Angeles, one in Chicago, and one on Rikers Island in New York City. We know that a lot of folks who are hurting end up in that cycle, and we're trying to see if we can't stop that from happening. That's why we're here. What's it going to look like day in and day out? I'm going to be perfectly honest with you. I was kind of told not to say this, but I don't really know. And the reason I don't know is because I can't say when someone's having a mental health crisis. My team is going to be based out of here most days. Also, my officer that works with the HRA housing in this neighborhood, Officer DeAndre Clark, is going to be based out of here as well. We're going to do some meetings with our Benton County Community Action Team. We're going to do a whole bunch of different things like that. But when they're specifically going to be here, I don't exactly know, because I don't know when someone's having a mental health crisis. And I don't need them just hanging out having office hours. We had an awesome, amazing ribbon cutting, and some of you guys were there the other day, and it was cool. And I told my entire team, hey, make sure you're there. And we had 5 mental health calls for service going on at the same time. The only one I told had to be here was the dog. I didn't even care if the handler dropped him off, but the dog had to be here because everyone loves the dog, right? So we adapted River, and we got River in May as one more solution. What we tend to do, especially when someone's in a mental health crisis, we throw spaghetti against the wall and see what sticks. Because I have no idea what's going to work at that moment, at that time, for that individual. So what this is going to look like, we're going to see what happens. We'll be here as much as we possibly can. The goal is to be here when the clinic is open, at least to start, to make sure we have, just in case somebody is having maybe a crisis or maybe has some aversion to something that's happening or they're upset about something, we'll have the dog here, we'll have officers here, we'll do the best we can to try and keep that safe and secure as well. Additionally, we get the chance to, and I don't think we have dates quite yet, we have 2 picked out where I get a chance to be back here and talk to as many people that want to about situational awareness, about being observational, about the different things that are happening around you, about the different things that happen in here when we're stressed out, we encounter somebody who's upset about something, talking about buzzwords like de-escalation and pre-escalation and things like that, but also what happens inside here when we're mad, when we all have biases and we see things that maybe bug us just a little bit, what happens then? And how do we work through some of those things? So you may encounter people that maybe you haven't really seen before. Our goal is to try and keep that as to a dull roar as humanly possible, to help that individual. We're going to try and do some things like make sure we put signage on that door that we occupy so that when we're not there, people know exactly what they need and where they can go for those resources versus maybe knocking on other doors. So we can make sure that they're directed to the proper places. I talked as fast as I possibly could, and I got a couple questions already, so please, one thing, remember, I've been a cop for 27 years, been around way too many gunshots. I am deaf as you wouldn't believe, so if you could speak up for me, that'd be awesome.
So Tad, this is great. You've given a lot of information. I love that you're citing numbers. You might have already said this.
Yeah, absolutely.
You might have already said this. I was just curious. Do you have any numbers, or are there any numbers about the recurrence of certain individuals when you're talking about 1,100 down to 600? You know what am I being clear enough?
Recurrence.
Like how many people are coming through?
So specifically, they don't keep data and we don't get it from Centricare. What we did tend to find anecdotally was that we were dealing with, I would say, a good portion, if not half of the folks of those 1,100 were repeat. And some of them 15, 16 to up to 30 times a year. What Centricare is telling me is basically the 400 we're seeing now, there's 639 from last year, are almost all unique cases. And not to get too deep in the weeds, one of the things we found for a while was we were getting a lot of, this sounds terrible, but it was what I call dump and goes from group homes. We were getting a lot of group homes. We have 150 registered group homes in the city of St. Cloud, by the way, of different licensure and things like that, actually 152. So we have a lot of great group homes, but some will just, if they have an issue with the client, maybe not proper trained, they'll just drop them off the ER. We have people that are living in our emergency room in the St. Cloud Hospital for up to a year or 2 at a time. So we were working through some of those things as well because we were finding that was disproportionately from group homes having people coming and going more often than not. But that's a roundabout answer to your question because I don't have solid numbers, but I know that it's reducing it. I know we're not seeing that individual that's going there 10, 15, 20 times a year. I appreciate the question.
What are you doing on weekends? I heard you're talking about during the week.
Yeah, so as far as weekends go, I get asked that a lot. And one of the things is trying to especially hire a therapist who has a 4-year degree and then a master's degree and then does 2,000 hours of supervision. And most people who go into therapy and do all of that education do it with the idea that they're gonna, like some people in here, they're gonna sit across the couch from somebody and talk about how all their problems stem back to their mother, Monday through Friday, 8 to 4, right? My mother is fine, by the way. But it's hard to get somebody, unless I can prove via data, it's hard to get somebody with all that advanced licensure, with all that education, that wants to work evenings, weekends, holidays until 4 o'clock in the morning, wearing a ballistic vest, which by the way they do, going into that acute mental health emergency. So I have to prove via data that that is necessary. And unfortunately, I can't prove via data that weekends and overnights are necessary. The vast majority, I don't know if anyone knows this, one person here knows this, throughout the nation, the busiest day of the week that has the most mental health crisis is Wednesday. If anyone can explain it to me, please help, because I have no idea why. But days of the week for calls for service across the country, law enforcement reports, Wednesday's the busiest day of the week. The times, 10 a.m. to about 6 to 7 p.m. That's kind of been standard throughout the time frame. We don't see a huge up and down when it comes to Saturdays and Sundays, so it's hard for me to justify having people stay. So what's the clinic going to be, or what's our space going to be? A Monday through Friday and overnights. Like it or not, what's going to happen is I'm actually going to open it up because we're going to have key card access. So patrol officers of the 122 police officers from the city of St. Cloud, when they're taking their lunch break, I want them to do it upstairs. So there'll be a squad car on the north side once in a while at 3 o'clock in the morning. It's not because anything bad is happening. I love that when people are like, what's unsafe if there's like 6 squad cars around? I'm telling you, if there's 6 squad cars around, that's the safest place in the world at that moment, right? Because there's 6 of us there. So that's what it'll look like on the weekends, them taking breaks and things like that.
I want to just open up the Q&A for nursing staff as well. Can we introduce the two of you, Rochelle and Mary? I'm sure they're probably doctor this and doctor that, and all I know is Rochelle and Mary, so that's not very helpful. But could you please just introduce yourselves so everyone knows who's in the room? Because we have like another 20, 25 minutes, and I want to allow people to ask you questions or Sergeant Hessian questions as well.
So we're both faculty at St. Ben's. We're nursing faculty. I'm Rochelle Larson. I've been there 28 years now as a nursing faculty. So we're very excited to be here. If you see one of us, that usually means we have a student with us. We'll also have a graduate nursing faculty. There'll probably be 2 of them, Jennifer Peterson or Dr. Mary Pesch as well. So we're glad to be here.
Thanks. And hi, my name is Mary Zelenak, and I have taught full-time at St. Ben's St. John's for 5 years. My entire rest of my career was spent as a public health nurse. So I have worked in communities. I've worked for both Sherburne and Stearns counties as that public health nurse in different roles. So community is something I love. And I will be here with the first rotation of students starting on August 27th. We'll be here on Mondays and Wednesdays in the afternoons to begin with. And then we definitely hope to expand as time goes on and as we talk to the community and see what the needs are in the community. So, and then Rochelle will be coming in October with the next rotation of students.
Awesome.
Questions?
So I'll keep walking around with the microphone for questions, and if you 3 wouldn't mind sharing the mic, that would be awesome. And why don't you say who you are?
Hi, my name is Stephen Roenfeld. And one of my questions is how are we getting the word out to the community that this resource is available? And the times and that sort of thing.
No, that's a very good question.
Well, we have a great answer. You have a great answer to that one with Riverside. And
Right.
us going out into the community.
Right, so that's where we're going to start. Right now, we're still working on a website. We're still working on some brochures. Elena developed some brochures over the summer, but we weren't able to put dates and times and specifics on those. So we'll probably resurrect those and add a little bit to them. And then what I plan to start with at the very first day is to head over, I'm geographically challenged here, okay, to the Riverside Apartments. We've made some connections. I've talked to the manager there, and then hopefully with Officer Clark, we'll be able to go into that building and ask the people there what they would like, what services would they like us to provide. And those services may actually take place over there in their community room. If we are going to offer maybe a yoga class or a diabetes education class.
Probably not goat yoga. Not in the
No
community
goats
room,
first,
but
no.
who knows?
We may ask them, do you want us to offer it in your site, or would you prefer to come here to use one of the classrooms here? Looks like you want to say something, Elena.
We also have other community outposts that get a lot of traffic too. So people are traveling further to go to those other community outposts that we already have up and going. And so the fact that now there's another one. And then also we have a ton of community partners. So that means everyone that each one of us is interacting with is hearing about this clinic in a new way, or maybe going to hear about a new resource that, sparks something for them or for a loved one. So word is traveling very fast. I think also when you have such large entities like CentraCare, St. Ben's, and St. John's, and the police department, and the St. Cloud Public Safety Foundation involved in things, you might not realize how many places they actually are involved in locally and smaller. And so I think it will be very easy to get the community out here and using those services.
Hello, Jackie Johnson. And the question I have is for the healthcare team. Will you be able to log into my chart, and does all of that work then get reflected on the health history of the client? Do you want to take it or you want me to?
So when Project Heal is here, so when the nurse practitioners are here and they're providing services, they will have a team member from Project Heal, so basically CentraCare, and they will be able to log into the My Charts at that point. Our students and faculty won't have access to that, but they have access to it. So at this point, somewhere in the future, we're hoping that we become more full-time, and that would take care of that. But yes, that's a great question.
When you go out to a healthcare emergency, you don't take all those people with you. Tad.
When
Tad.
you go out to emergencies, you don't take
How many of those people?
Yes,
On that
yes, we
team?
do.
All two social workers,
a member of the police department wearing pretty much what I'm wearing right now, a social worker and a paramedic all go together. They all wear ballistic vests to go into that emergency to make sure they can do it right then and there.
You said there were 6, and I hope that they didn't all show up at once.
Yeah. Yeah, that's the goal, is to have one of each have those expertise. Yep. And the dog, yeah.
Other questions folks have? Steve has another one.
Stephen Roenfeld. Actually, I mean, I'm looking at this list, and you mentioned you have, a police force of 144-ish officers. Is there talks about expand? Because I feel like, how do you do that with that team of people?
Right.
In the sense of, like, is there plans? I mean, how are we ever going to get to a point where 20% of the police force is doing this work as opposed to a small percentage of it?
Boy, you want to talk to my chief in the city council? I would love that. So, yes, the goal has always been expansion. So, like I said, in 2018, when I started it, it was me and one officer. We now have these 6 and myself just focusing on mental health. We have 1 just focusing on potential for targeted violence and 2 focusing on crime prevention. So we expanded it from me and 1 to me and 9. So we're always looking to expand. I think the next iteration is focusing on folks who are struggling with chemical addiction, and specifically after the fact, having a team that is kind of does that potential follow-up. So yeah, it's there. It's just a matter of, with 122 sworn, just trying to find out where the FTEs fit the best to meet the community needs. But I think because of the 1,000 calls for service, we're finding the need is there. So the expansion will happen. I don't think it'll happen necessarily too much more in my career, but I don't have that much time left. And so to be able to kind of see how we get the next iteration, the next set of ideas, I think will be important.
Are all your questions answered, my friends?
Can I just ask a question about what hours is anybody going to be at the outpost?
What? I'm just repeating it.
What would be the time frame when you could send people to them?
I'm just repeating it for the live stream, Tom. So Tom's asking, what are the hours that we would be able to send people to the clinic? Is that specifically what you're asking?
Yes.
Because I think Tad's team isn't somebody we exactly send people to, correct? That would be more like we'd have to call 911 if we needed you.
Absolutely.
Yeah. So the clinic itself, you want to answer that question for us?
Sure. So again, we're starting small, and we'll be starting at the end of August with myself and 2 students Monday and Wednesday afternoons from 1 to 4. We will be adding about mid-September the nurse practitioner and their students, so the people that can see appointments, they'll be added in. We're waiting to hear if that'll be Monday or Wednesday afternoons, but it'll be alongside the undergraduate nursing students. So if someone was having an acute illness and, for example, they felt they needed to be seen by a doctor or a provider, and they came when an undergraduate nursing student is there with me, with one of us, we would have to send them to, we'd have to give them another resource because we can't prescribe, we can't do some of those tests. Or we may say, if you come back on Wednesday, there will be a nurse practitioner here that can see you for free, if you can wait till Wednesday. So I wish I could have a more definitive answer for you, but at this time, just because we're brand new, we're starting, we also don't want to promise something we can't deliver.
We also surveyed in the community. That's how we got the hours we have right now. So this summer, we went out and talked to community members, and also at Fair for All here, we talked to people what afternoons would look best for you, what works with your job schedules, or what would be easiest with your families, things like that. And so that's how we got to Monday and Wednesday. So it's not like we just woke up and we're like, that's it, that's when we'll be here. We were talking to people and figured that out too. And then also it's not just gonna be us, soon it will be more people and more space and more like sustainable programming that runs longer. So hours will bulk up and resources will bulk up too,
So for example, we might not be here as nurses on Tuesday mornings, but Benton County Public Health WIC might be here, or Children's Dental Services, or the healthcare navigator that Tad's been working with, the connectors. So we're hoping, although Monday and Wednesday, that just sounds so little, that there will be activity at the site ongoing,
If you build it, they will come.
We have talked about having a shared Google Calendar so that our office can know when people are in the building and in the clinic. So that coordination administration piece will be in place one way or another. But it's definitely going to be just like everything, when we do any brand new thing, right? Step by step, baby steps to make sure you can really deliver on the promises that you're making. So I think there is a certain amount of patience that we as Salem are probably going to need to have, even though we had to have lots of patience for the construction, lots of patience for construction to start, and then lots of patience for construction to be done, and then lots of patience for, it's just a process which is wonderful to see the kind of partnership happening between these different agencies. But if you've ever worked in any kind of job that's bigger than just independent yourself, you know how much work it is to get different agencies and businesses to work together, right? And organizations. And everybody's very much wanting to do so, but it still just takes time to collaborate. So that would be the encouragement I would have as somebody who's just been sitting in on meetings and trying to ask your questions. I've asked that question a bazillion times, Tom, and every time I'm like, I'm not trying to be mean, but when are people going to be here again? So we just keep working at it and keep asking for updates as well. But I do think it's important for us to all hear that it probably isn't going to be a situation right away where we can just send people to say, oh, just go over to the Salem Clinic anytime. That's not going to be a thing. We're going to have some kind of schedule posted and some sort of announcements made and some appointments for people who are wanting to be seen. So all of that is still a little fuzzy to all of us. Is that fair?
And I would expect in 1 year from now, things will look very different than they do right now.
We get to be on the ground floor. You don't always get to hear about this level of a project, right, as a community member, because if it's being done among organizations that are not public, then we would know about it. But because we're in this congregational situation where we're sharing our space, we're getting in on the ground floor of information, which means we get the slow trickle, right? Rather than, that thing is something we need to be sure to tell everybody about and start using. You know, sometimes you don't get aware of a project until you're already at that point as a community member. Not quite the case here. So the good thing is we have this number of people who are already in on the ground floor who can start talking about it and helping to set expectations in the wider community about what is currently going to be available and then what will be coming in the future, and helping people also look forward to that happening in the next many months. All right, I'm feeling like maybe we should get wrapped up, but is there anything else?
I have
Final
one
words?
last thing to say.
Please.
We always get questions, and we've gotten several questions from the congregation about your involvement. How can you all be involved? And Elena had a slide up there. We will get more information to you as things start rolling out about the roles that we need for volunteers, and how do you sign up to be a volunteer, and what kind of training you might need. And I know Tad mentioned there's going to be some de-escalation training. So those more to come on those pieces. And I know Lori, one of the members of the congregation, is working on being your liaison as well for volunteers. So we will get the word out through Pastor Kirsten, through Lori, but if you see Mary and I'm speaking for Tad, but if you see us, please ask us if you have questions, or there's anything that you feel like, gosh, I think this would be great for the community. We are so open.
I can't handle people speaking for me. I'm kidding. Real quick, I just wanted to say I will put a bunch of these out back. So these are actually the flyer of this team, not that one anymore, but actually with the team, with our contact information on there as well, also resources on the back, as well as I will put a whole stack of my business cards out there with my direct number on there and my email, and my cell phone is on here, and my wife loves that my cell phone is on my business card. She also loves that this cell phone gets reception in the Rocky Mountains, and I answer it, and I'm never in trouble at all. That it's out there for a reason, though, because I think if you guys need a contact or you're concerned about something, I want to make sure, because I get that there could be some trepidation with all these new things happening and bringing new people into a space where you're comfortable. I want to make sure that we're all comfortable together, so please go ahead and give me a call. Also, some information on the team will be back there. Thank you so much.
Thank you to all of you. Can we give you a round of applause as a thank? So the final thing I'll say before I excuse you, guys, is that, as was mentioned a couple of times, I want to be clear for us as Salem, the training that Sergeant Heschel is going to be doing with us will be in September. There could be multiple ones, but the first one will be in September. And if you are a council member, or if you volunteered to be an usher greeter, or there's one other, or if you're on staff, those are the 3 categories of people who are getting an invitation to that training right now. And if you didn't get an invitation and you want to be on the list, please just contact Juliet. We're happy to train everybody that wants to be trained. But we're pinning down a date between 2 at the moment, and then we'll put that out there, and you can know, okay, some of our people. And I want to say one other thing about that, and that is, this training we are privileged to be doing because we now have this great relationship with the police department. I'm sure Tad would have come and done this earlier as well, but we didn't take advantage of that. And we have had people in our building on a Sunday morning, way before we had anything going on with the Outpost, who have been in need of our understanding better what's happening with them and how to respond to people with mental health crises. This is not a new problem for Salem. So I just want to say that out loud in case anyone thinks that this is something we're suddenly expecting to have happen. Not the case. Been happening for years and years. And so I am so grateful that we're going to put in some more conscientious plans around that, so we can be even better neighbors to those that come in our doors, whether they're strangers to us or people that we're familiar with that we want to be able to help. So, all right, thank you for letting me get that last word in. look for your email or let us know if you want to be part of that training. Otherwise, for now, just keep sending your questions in. Thank you, and thank you to all of you for being here.